Welcome everybody. With you Dr. Magdy Abdel, Razek, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about hypotension. The usual blood pressure range between 120 over 80. This is in most of the people, especially young people. But sometimes this blood pressure may increase above 140 over 90, and in this condition we consider this patient a hypertensive patient. If the blood pressure decrease below 90 over 60, we consider this patient is hypotensive patient. Today our topic about hypotensive patient, about causes and manifestations and treatment of this condition. So the blood pressure is considered the force of blood pushing in the arteries. This is from cardiac pump. And as regard this hypotension conditions, it may be severe and it may be lead to hypotensive shock. So what are the causes of hypotension? Maybe excessive exercise, maybe excessive heat, sometimes cases of hypovolemia like hemorrhage or diuretics lead to hypotension. Sometimes hormonal disturbance like thyroid function and also suprarenal gland. If there is any disturbance in these glands, may lead to hypotension. Also anemia, especially in females, may lead to hypotension. Sometimes anaphylaxis, sometimes heart problem like myocardial infarction or congestive heart failure, sometimes lead to hypotension. Also bradycardia sometimes lead to hypotension. In some cases of severe sepsis or septicemia, sometimes lead to hypotension. In some cases of acidosis, whether from renal failure or from diabetic ketoacidosis, any cause of acidosis may lead to hypotensive condition. Also in spinal anesthesia or general anesthesia, sometimes in operation theater, sometimes we find that the patient suffer from hypotension. In some cases like orthostatic hypotensive conditions, if the person stand up suddenly, he sometimes suffer from dizziness, and we call this orthostatic hypotension. And we diagnose it if the systolic measures decrease more than 20 degrees than in supine position. Also in some cases like vasovagal attack, sometimes we find that the patient suffer from syncopal attack from hypotension, and we can diagnose this vasovagal attack from test called tilt table test. So it is very important to diagnose the cause of the hypotensive condition. Also in some cases we find hypotension if the patient eat large meal after half an hour or after 2 hours from eating meals, especially large meals, we find the patient suffer from hypotension. This is due to direction of the blood into splanchnic areas and this deprives the other vital organs from the blood. So many conditions may lead to hypotensive case. So it is very important to take medical history from the patient, and we examine him thoroughly, and we can make some investigations like CBC, like renal function test, like hepatic function test, like hormonal function test. Also, we have to examine the heart. Also, we have to examine the patient neurologically. In cases of mild cases, sometimes if we give this person cup of coffee, this will improve his condition. But sometimes we give the patient intravenous solution like saline or ringers. Sometimes we give intravenous blood or blood products, especially in cases of hemorrhage. It's very important to know that in some medication like noradrenaline or dobutamine or dopamine, this improves the condition, and the doctor who determine the suitable medication for the treatment according to the condition of the person and the patient. Sometimes we give erythropoietin. This improves the viscosity of the blood. In some cases, the patient suffer from severe hypotensive shock. So it is very important to admit the patient, and especially in ICU, to improve the blood pressure of him. Sometimes we put the patient on monitor and observe him 24 hours, especially if the patient suffer from cardiac problem like severe heart failure or myocardial infarction or severe bradycardia. In these cases, cardiologists treat the case, and the patient admit in ICU. In cases of severe infections, the best management is intravenous antibiotics. This will improve his condition, and this will improve the blood pressure. Thank you very much.